parenting will happen more and more as a community. 85% of millennials believe that community service is an effective way to solve the nation's problems. Millennials don't tend to hold rallies, don't tend to do protests. They tend to take small actions at the local level that they believe will actually affect change at the larger level. They're willing to believe that you can have that sort of avalanche effect where many people will do something small and create a larger change. And that individual initiative is the preferred way to tackle major problems. They don't necessarily, governmental programs are one thing, but so they want the government to have a great school system, but they definitely believe that they have to be part of the PTA for that to be a really great school system. And as much as it's been derided by folks like Sarah Palin, community organizers are believed to be have a crucial role in American society moving forward. That's a position and a role that's really believed in by this demographic, as opposed to a more Generation X, sort of late boomer demographic that believes that that's like the most worthless thing that you could possibly have. So there's definitely a generational play involved in those types of roles in the community. And of course, parenting will be more connected than ever. We all know that the younger you are, the more likely you are to use every bit of technology and social tools, so it's not really worth going through that. What it is worth noting is that 58% of millennials have privacy restrictions in place on their social network profiles. They understand what the boundaries are. They don't need to be told. In fact, it tends to be the older millennials and the younger Generation Xers who get into trouble when it comes to sharing things that they shouldn't. Millennials definitely get that and understand it. And with that in mind, community is a broadening term. You know, it used to be the folks who lived on your street, then it was the folks who lived in your town, maybe within a few towns once everybody had cars. Now it's really the people who are closest to you wherever they happen to be geographically. And that creates a major change and a major tension. You know, local community organizations can have trouble recruiting folks from their local neighborhood when they're equally tied to a group of folks who happen to be 3 time zones away. And for millennials, using social media is less about participating and much more about contributing. The number of millennials who are chasing a follower count is really low compared to Generation Xers. Instead, they're not concerned with having 40,000 followers. They'd rather have 400 followers that they really know and that they can really communicate with. So social media today, the social media sort of scene is all about generating follower accounts and sort of justifying its existence by getting eyeballs. And that's something that I don't see really taking as these millennials become the dominant sort of young adult and market force that they inevitably will, as long as the economy doesn't tank, which it may. Who knows? So with all that said, and all those predictions, the best way to predict the future is to invent it. And so I'll just take a few minutes to talk about what we're working on for WeSprout. From our perspective, parenting's tough, and whether you're dealing with like really complicated medical conditions or just potty training or how to get your kid to fall asleep or when to come home from work, we're working on a way that'll help you get in touch with parents who've been in your shoes before and are able to share their experiences with you. We think that our industry, now I can sort of put myself in this sort of healthcare tech industry, we believe that the industry is failing today's parents. When you look at technology and data, they tend to throw every number possible at you and say, look, it's open data, here it is, you can see everything, with little context and little understanding of what that data tends to mean. At the same time, when you go searching for information, it tends to be a Where's Waldo puzzle. You'll be looking for an answer to your question, and you'll say, oh, you know, maybe that's, no, that's not actually it. Maybe that one is, no, that's not actually Waldo, until you find the right answer for you. The most useful communities are more than simple forums. They're not blogs, they're not just places where people can post and comment. Instead, they're really built on useful data, and we're getting to the point technologically where we can start to take advantage of that. In WeSprout's case, we consider data in a few ways. We think of sort of a child's health data is, you know, their height, their weight, if they're a baby, their head circumference, those types of simple statistics, as well as their history, which would be, they had spina bifida, or they tend to have a lot of ear infections. We'll look at their immunizations and their current medications and history, and we'll also look at their location, because you can start to see if loads of folks are having fevers in the same geometric area or same geographic area. There could be something to that. And with all that, we roll that into a great visualized health record. This is sort of half of our product is a PHR for children, that we try to visualize it in an effective and engaging way that is really best suited for pediatrics rather than for general medicine. In addition to that, we give you the same types of tools and growth charts that you would get at the pediatrician based on the CDC and WHO guidelines. And so in addition to that, that's just sort of the beginning. Based on that data, each person who's a user has their child's health history and health record supporting their profile. And so when they have a question, we look through the other users on our system and we kind of heuristically compare each of those users, and we say, do they sort of match up? Do they have children who have similar histories, similar conditions? Are they in the same location? And we can say, oh yeah, there are definitely some similarities here, and we can go ahead and match them up. So in that sense, we can serve as a platform for parents who just want to get their kid to fall asleep. They've been trying for hours and they can't figure out how to do it. Or their child has Down syndrome and they need to talk to parents who have experience going through raising a child with Downs. Or they live in Berkeley and just want to find a great daycare center where their kids can play with mirrors all day. Any of those in our context is a great reason to reach out to other parents whom you may or may not know to look for answers. So in our case, parents share questions and resources. Questions are exactly what you would think. Resources are links to websites that they found particularly useful. And once we know a question is about a particular child, we'll ask if it's about one of that child's issues that we know about. It might be about conjunctivitis, so we know that other parents whose kids have had pink eye in the past might be able to answer this question. And once you've asked a question, we suggest similar questions that have been asked along the same lines, which is a friendlier way of doing what customer support websites often do, saying like, are you sure you haven't looked for the answer yourself yet? But we definitely want to make sure that everybody's answers can help not just the person who asked it, but the entire community. And then from there, we'll suggest topics and tags to help reach the right audience of folks. So in this case, cloth diapers is a topic that might be followed by folks, and we'll recognize that it's about San Francisco and make sure that parents in San Francisco are prompted to answer this question. And then in the end, we post that question for other folks to answer, and multiple folks can answer them, and answers get voted up by the community, and the person who asked the question can say, this was a helpful answer, accept it, and they'll actually credit the account of the person who had given that answer. So they get a credit, they get an award for having done so, for helping out the community. And in fact, WeSprout's going to be a paid product, but it costs less the more productive you are in the community. So we're trying to incent that sort of communitarian sort of action and activities. And we push it out to you. We push relevant questions out to your dashboard so that you'll discover them, and once a week we'll send you an email saying, here are the questions actually that parents like you are asking. Because sometimes you don't necessarily know what the right question to ask in the first place is. For instance, I learned on WeSprout a couple days ago, we're launching like any day now, so, I learned a few days ago that the best way to treat pink eye is to soak your kid's eye with breast milk, which I would never have thought to do in a million years. That would not have been the first place that I looked for a solution. Better than antibiotics, in general, for viral and for bacterial.
Your fiance agreed?
She did, yeah. She's like, yeah, I've heard of that a few times. Let me ask my attending tomorrow. And the attending came back and said, yeah, that's legit. So we're trying to look at millennials, see where they're going, see how they're going to be different parents in the future, and how we can really support some of those needs for connectivity, for doing small things to help a broader community, and to really take advantage of the technology that we're doing today, and so we're trying to build that. So that's it.
this is great. Can I ask you a question?
Yeah, absolutely.
About the last part where you put in the dashboards the information that you garnered.
Right.
How do you filter out those things that aren't following certain, based on meta-analyses or other things that are credible or something in the literature that can support what the parent is, because you don't want to post anything that,
It's a myth.
is a myth. Right.
So I think that the long-term view is that the community will sort of sort those things out. The parents who have made valuable contributions in the past
Right.
are the ones that are going to filter to the top naturally.
By the credit